Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to No Show, we're going to go over how you can avoid a knee replacement disaster. Before we jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos. So it's unfortunate, but there are some folks out there who do have what they would consider a knee replacement disaster after surgery. And this can be for a variety of reasons. It can be because of pain or increased pain after surgery. It can be because of a complication, maybe an infection, maybe a blood clot. It could be just because they aren't satisfied with the outcome. They don't feel like they have more mobility or more activity tolerance or function, and so they just aren't satisfied with their surgery. But I believe there are some steps and some things that you can definitely do to help significantly reduce your risk of having a knee replacement disaster. So one thing is, as you go into the surgery process, is having realistic expectations. And this is for a couple different things. So one is about how long the rehab and recovery really is after surgery. A lot of people think that within a couple weeks, they're going to be completely healed and recovered and back to doing what they want to do. But for most people, this isn't really the case. More often, it takes a number of months, sometimes up to 6 months, sometimes a year, or even a little bit longer, to really feel fully recovered from surgery. So having realistic expectations about that timeline. And also realistic expectations about your physical status and your symptoms once you are recovered from surgery. It's definitely not uncommon to have some lingering symptoms after surgery, some pain, swelling, stiffness. Now, for most folks, these are much less severe, a lower intensity, and occur much less frequently after surgery compared to before, but it is very common to have some of those lingering symptoms. So having a realistic expectation that this may be the case. We also want to look at ways we can reduce your risk of a complication, such as an infection, a blood clot, a fracture. So one of the best ways is going into surgery with as healthy a body weight as you can. Now, you don't have to be perfectly lean, ideal, absolute ideal body weight, but as much as you can, getting to that healthy body weight is just going to help reduce your risk that much more of having a complication. Also, if you're a smoker, quitting smoking is definitely a big way to reduce your risks of complications. If you're diabetic or pre-diabetic, making sure your blood sugars are well controlled, and just making sure you're getting adequate nutrition. So a significant percentage of people who have a knee replacement are a little bit older, and malnutrition tends to be a little more prevalent in the older population. So make sure you're getting adequate protein, as well as carbohydrates and fats, but definitely getting lots of protein to help maintain your muscle strength and build back your muscle strength after surgery. Also, just making sure you follow the instructions of your surgeon, your doctor, your healthcare team, things to help provide antiseptics, maybe having you take antibiotics to reduce your risk of an infection with surgery. We also want to reduce your risk of having a blood clot. And there's lots of steps that we can take to reduce that risk. So first, after surgery, early mobility, getting up and walking and moving that same day of surgery, doing some simple exercises like ankle pumps and heel slides. You'll probably have some compression, some intermittent compression as you come out of surgery. And you may incorporate some compression throughout your rehab and recovery, such as through wraps or different compression garments. And just following anything else that your doctor recommends, such as some prescription medicine to help reduce your blood clot risk. Of course, also important and also prevalent is pain. So staying on top of our pain is very important. So looking at a multimodal approach. So what that means is looking at multiple different ways and multiple different things you can do to help manage your pain effectively. So of course, there's opioids, prescription pain medicine, but there's other medications such as NSAIDs or Tylenol, there's icing and heat, there's use of compression, elevation. Of course, some of the exercises and stretches you'll do in the long term will have pain relieving benefits. And also just other alternative practices such as meditation, mindfulness, things of that nature can be great pain management strategies. With going back to your exercise, we want to make sure we're consistent. We're making sure we're doing lots of repetitions, going through your exercises multiple times per day early on after surgery, as prescribed and recommended by your physical therapist, by your doctor. And just working and staying consistent to regain that range of motion, the bending and straightening, and also starting to build back your muscle strength early on after surgery. We want to make sure we get that range of motion early on before that scar tissue starts to develop in the knee, and it gets harder and harder as the weeks progress. So really focusing intensely and staying consistent early on is very important. And also building up muscle strength for the same reason. You lose quite a bit of strength and force production in your muscles after surgery. So the faster we can regain that strength, the more efficiently, the faster you're going to be back to walking and moving and doing things better and at the level that you'd like. And as we go on, looking and thinking long term, avoiding those high risk things that are going to decrease the longevity of your replacement. So things that include a lot of running, jumping, cutting, twisting, high speed running and sprinting, high intensity weight training. Things like this can put an increased stress and do put an increased stress through your knee replacement. And if you do that a lot, you're going to decrease the longevity of that knee replacement, most likely, and have the increased risk of needing a revision surgery down the line. So doing things long term, using common sense, using moderation to help maintain the longevity of that knee replacement. So really, those are the top things that I would recommend. When in doubt, talk to your surgeon, talk to your physical therapist, your healthcare providers, as they can help guide you and give you the proper instructions that you need. And hopefully this helped those of you going into the knee replacement or are in the knee replacement journey right now. Please be sure again to hit that subscribe button, hit the like button if you found this helpful, and as always, please leave your comments and your questions below. Thank you for watching.